Hello, and welcome to the Transformation Health Team's Tool of the Month video series for the month of September 2023. My name is Brad Sollenberger, a lean coach for the Transformational Health Team, and in this video, I will be covering some of the basics of the Kanban system and sharing potential applications and benefits of utilizing Kanban systems in different ways. First, what is Kanban? In Japanese, Kanban can be translated as visual signal or signal board. How is Kanban used? The term can be applied in a couple of different ways. It is most often associated with inventory control, and we will discuss two popular methods for handling just-in-time supply or inventory replenishment later in this video. Kanban can also sometimes refer to a system or board to help in the visual management of work in progress. To help demonstrate the benefits of a Kanban system, let's look at it in this illustrated model. Recall that Kanban means signal board or card, and in this case, a physical card is placed within the inventory itself. All inventory before the card is called the primary stock, while the inventory behind it is called the par level stock. Once inventory has been utilized down to the par level, a card will become visible, and the last user to draw down the inventory is expected to use that card to place an order for replenishment. These cards are most helpful when the relevant information for reordering is printed on them and kept up to date. By the time the order is received, the par level should be close to depleted or just depleted, hence the phrase just-in-time delivery. Benefits of a system like this are a reduction in inventory waste, increase in available storeroom space, and a reduction in inventory or spoilage. You'll be less likely to experience stockouts as well. As opposed to a card in a single bin, another way to visually manage Kanban inventory is utilizing what's called a two-bin system. The two-bin is extremely popular in healthcare settings. Just like the first example, once inventory is drawn down from the primary stock and empties the bin, that is the signal to order more immediately. A signal card may or may not be utilized in this system. If replenishment happens before the par level bin is drawn down, anything that is left in the bin is removed to the primary bin so as to be in accordance with first in, first out principles. Here are a couple examples of how inventory control can be utilized in healthcare settings with a two-bin system up top and a single bin and card system below. That sure looks tidy and efficient, doesn't it? They certainly won't get caught with expired supplies when Joint Commission does environment of care rounds. Now to discuss Kanban for work in progress. Essentially, a Kanban system for managing work in progress is to implement pull and improve flow. To better understand this, let's first look at a scenario where work is done via a push system and how that disrupts flow. As work is completed by the first operator, their completed work is pushed onto the next operator, whether they're ready for it or not. In a push system, which is synchronous, prone to bottlenecks, and capacity of all system operators is underutilized, this creates waste. These outcomes are not good for flow. In a Kanban system to manage work in progress, once it's requested or completed by the initial operator, the work goes into a queue where work in progress items can be pulled once the next available operator is ready to process it. Compared to the previous push system, you can see here how being able to see or visualize the work in progress can promote flow, allow for parallel processing, and improve capacity utilization. Used in this way, Kanban can empower the operator to pull when they are available, which not only improves flow, but also reduces stress felt by the worker. A couple of brief notes on Kanban boards for our work in progress. They can be physical or virtual. The most important thing is that they are visible to all the teams or operators within the system. Consider the space your operators are working in. Are they not often at a computer? Would a physical board with patient information be visible to other patients? These are things to consider when implementing a Kanban system. At minimum, it should contain a visual lane for requested, in-progress items, and completed items. If needed, the board can be embellished with further stat designations, work in progress limits, and other swim lanes. One final note, a task board is not a Kanban board. A Kanban board visually represents the patient or a product as they move through a process. A task board is a list of individual tasks assigned to personnel. While Kanban boards are less common in healthcare than Kanban inventory systems, they are most commonly seen in health IT and project management. In clinical settings, however, case management teams and pharmacies are areas in which Kanban boards have demonstrated success. But the truth is, anywhere in our health system where multidisciplinary teams, multiple modalities, or complex care takes place is an opportunity to use Kanban to manage the flow of our patients through the care setting. I want to thank you for watching this month's presentation on Kanban and how it can help your team improve inventory replenishment or visually manage work in progress. If you or someone you know would like to keep up with the latest healthcare transformations and the incredible ways our partnering caregivers at UCSD Health are transforming their work and the lives of patients, please join the Transformational Healthcare mailing list by going to our Blink page. If you would like to learn more about implementing this tool or are interested in other ways to infuse lean principles into your daily work, please email our coaching team at tht@ucsd.edu.